Hey, good morning, everyone. I hope all of you are doing really good this morning. Thank you for joining me. It's at 11, it's 11:14. Sorry, it's about 11:31 now, and we will go ahead and start the webinar. So the webinar today is with Dr. Luqman Mazlan, who's a consultant general and colorectal surgeon, and as well as the medical director of Hospital Picaso. Good morning, doctor, and welcome to the webinar this morning.
Morning, Vishala.
Yes. So before I start the interview, just some housekeeping rules. We will have 5 minutes Q&A at the end of the webinar. So if you have any questions, please drop your questions in the Q&A box. Do not drop it on the chat because it may get drowned. So just drop it in the Q&A box, and I'll come to it at the end of the webinar. Okay. So let me just start. Okay, Dr. Luqman. So we will be speaking about colorectal cancer, and as you know, this month of March is Colorectal Cancer Awareness Month. So I think the very first question, or the first basic question, is what's the most common risk factor of colorectal cancer, and what is colorectal cancer about?
Okay. Before I start, I'd just like to wish everybody a good morning. Assalamualaikum. And thank you very much for Cancer Research Malaysia for inviting me here today. I think it's very encouraging. I'm seeing almost 276
Yes.
people joining, right? So that's very encouraging. Okay. Now, to answer your question, colorectal cancer is the most common cancer among men, right, in Malaysia, and the second most common cancer among women, second to breast cancer.
Mm.
And because it's so common, I think it's very important to know what the risk factors are. When somebody asks the question about risk factors, you can always divide it into two. One is modifiable risk factors, which means that something that you can change, and some things that can't be changed, which means a non-modifiable risk factors. Okay. So the non-modifiable risk factors are obviously age. We know that colorectal cancer is a cancer which increases, the risk increases with age. However, I'm sure we'll talk about it later. We are seeing younger and younger people getting it. Obviously, if you have a family history, you have a history of a polyp or cancer before, also race, if you're Chinese in Malaysia, the risk seems to be a little bit more than the Malays or the Indians for some reason. Obviously, if you have some hereditary familial syndromes, that obviously increases the risks. Now, these are non-modifiable, means you can't change them. But the things that we should know, especially, is the modifiable risk disease, which is related to obviously diet, right? So if you have a diet with lots of red meat, processed food, reduced fiber, fruit intake, then there is quite clear evidence that over the long term, this predisposes a person to the risk of cancer lah. Now, obviously, may not only be colorectal cancer, but any cancer for that matter. Lifestyle is very important. So if you live a sedentary lifestyle, you don't exercise enough, you smoke, okay, and you drink excessive alcohol, all these can increase the risk of colorectal cancer. There are certain diseases that if you are diagnosed with and you don't control them, then there is some associated risk of developing colorectal cancer. Number one is inflammatory bowel disease. Some of you may know this, ulcerative colitis or Crohn's disease. But more commonly, there is some association with uncontrolled diabetes and developing colorectal cancer. Yeah. So I hope that answers your question.
Yes, I mean, the risk factors, I mean, especially the modifiable risk factors, does seem like a big problem in Malaysia as well, because, diabetic is an endemic here in this country. Our obesity rates are very, very high. So
Sure.
it is definitely a cause of concern for Malaysian citizens, and it's very important for them to take note, especially when it's a modifiable risk. You can make changes to your diet and your lifestyle so that it reduces your risk to the disease. So, doctor, Are there any early warning signs of colorectal cancer that people often overlook?
Okay, I think that's very valid question. Um, the sad thing about colorectal cancer in Malaysia is that two-thirds of these cancers present late. So you're talking about stage 3 or stage 4. So it's very important to know what are the early symptoms, okay? And I mean, the patients can present in many ways. Um, Usually, if you have very dramatic symptoms, like for example, rectal bleeding,
Mm.
or you passing up mucus, most people are very worried. So they will come to see a doctor. Where it may not be a specialist, they may go to see their local GP. Okay, but those are very dramatic symptoms. But there are very subtle symptoms that some that one should know. And I like to emphasize this all the time when I give talks like this, is about changes in your bowel habits. Now, everybody go to the toilet w- different times of the day, different frequency. Some people go once a day, some people go twice, some people go 3 times a day, some people go once every 2 or 3 days, some people go twice a week, you know. But I think it's very important to establish what is normal for you, because you may have this for years. But if that changes, so it changes in the sense that um, it becomes more frequent or less frequent, or more hard or more watery, anything more than 2 weeks, I think you should get it checked. Of course, sometimes if you go traveling or holiday, or you go you practice some new diet regime, it may change things. But I think if it's unintentional, more than 2 weeks, then you get changed. Because, nobody likes to talk about their bowel habits. Everybody's shy, even to their own, family members, so they're shy. So it's very important that slight changes in your bowel habits of more than 2 weeks, especially if you're above the age of 45 or 50, you should definitely to see a doctor. Yeah.
That's I think it's very good points that you've actually shared, because like you said, it's a very sensitive thing. People are not very comfortable sharing it. So if there is anything that is unusual, or like Dr. Lukman has said, that is unusual from what it normally was, please, please, please go and get it checked. Don't take it as simple, something that is simple, or you can just overlook it. Okay, doctor, you said earlier about modifiable risk and non-modifiable risk. Okay, and family history is one of the things that you've actually mentioned as well. How does family history impact colorectal cancer, and should relatives be screened earlier as well?
Okay. When we talk about I see many patients with colorectal cancer, and one of the common questions is there a risk for me, or to my family members, or just because they have it, can I have it? Am I an increased risk of it? Well, definitely. So generally, um, uh, about 80 to 90% of colorectal cancers are sporadic. Sporadic means they don't have a familial um, uh, risk factor, or they don't have any family history.
Mm.
There is a small percentage, you're talking about maybe 10 to 20%, that have a known family history of it. Okay. Now, having said that, if you are asymptomatic, if you're above the age of 45 or 50, depending on which country you come from, but I think generally in Malaysia, the current guidelines is 50 years old and above, and you have one family member with colorectal cancer, um, I'm talking about first degree relative.
Mm.
You're talking about siblings,
Mm.
or children, or parents. Then you should get yourself screened at the age of 50, or 10 years before the that family member got the cancer. So let's say that family member got the age of 50. Don't allow wait to 50. You screen yourself at 40.
Mm.
Okay.
Mm.
If you don't have a first degree family member, but you have two family members second degree, you're talking about grandfather or grandchildren. or maybe your cousin or something like that, but you have two or more, you should, I mean, that is an increase, there's a risk
Mm.
of getting or developing it. So, so generally, thankfully, the risk of you getting colorectal cancer because of a family history or genetic is only about 10 to 20%.
Yeah,
Okay, so but so it means that even if you don't have a family history and you reach
big
the age of
percentage.
50, the current guidelines or recommendation is get yourself checked. Yeah.
Mm, that's very interesting information you shared about first degree and second degree relatives having it, and how important is it for them to get it checked, at the age, at which age. It's a very common question that I normally get as well when I do presentations. Which age should we go and do this test? At which age should we go and do that test? So thank you, doctor, for sharing. Very insightful. So, doctor, what is the most effective screening method for colorectal cancer? I mean, for breast, we have the mammogram, we have the scan, but what about colorectal cancer?
Okay. Yeah, nobody likes to talk about screening for colorectal cancer because it is quite something that is not very pleasant,
Yes,
but nevertheless, it's very important to do. Okay,
correct.
so the gold standard meaning the best lah, the
Mm,
best, is actually a colonoscopy. Okay,
mm,
so a colonoscopy is a procedure where you come into the hospital. You don't need to stay overnight, but you need to clean your bowels before with some medications. You come in and you do basically a scope. Okay, they put
mm,
a flexible tube, a camera up into the bum, and they examine and we examine the colon lah. Okay,
mm, mm.
until the appendix. Now, this process is under sedation. You won't feel a thing. My own experience, I went through it, is that I don't even remember.
Okay.
It's done. So that is the best.
Yeah.
And you should get it at the age of, well, as I said, in Malaysia, it's 50 years old. But in America and all that, they're doing it 45. Um, and if that is normal, then you should, even if it's normal, I mean, hopefully it's normal, and you don't have any family history, it should be done once every 10 years. Okay, once
Okay.
every 10 years, right? If you have a family history, it's one every 5 years.
Oh,
Okay.
okay.
Yeah. So this is gold standard. However, colonoscopies take time. They cost money, and if you are scared or unable to do colonoscopies, then at the very least is you should do a stool blood test. Okay, a stool blood test. Okay, a stool blood test means you actually have to take a sample of your stool, and then you test it lah. So there are two ways to test it. One is you take it and send to the lab through your nearest clinic or hospital, or the other, nowadays we have stool test like a urine pregnancy test.
Oh,
Where you know how you want to test for pregnancy, you pee on
yes,
thing,
yes,
right?
yes.
So similarly, you take a little part of your stool, put it onto that marker,
Yeah.
and if it comes up with positive, then it's either a 2 bar or something like that. So now, what it means, it doesn't mean you have colorectal cancer. It just means that there's blood in your stools.
Mm,
Okay. It means blood in stool. So a normal person, well, obviously should not have blood in the stools. But and you're talking about blood that cannot be seen with the eye. If you
mm.
see blood in your stool, means you must get it checked definitely lah.
Yes,
But
yes.
sometimes the bleeding can be so small that the eye cannot see.
Correct.
If that is the case, then the test will be positive.
Mm,
If the test is positive, it can mean anything. It can mean you have hemorrhoids, it can mean you have inflammation, but it can also mean you have polyps or cancer.
mm,
So if
mm.
that is the case and it's positive, you definitely will move on to the gold standard, which is colonoscopy. Okay?
Colonoscopy.
So if it's negative, you should do it actually every year.
Okay.
Now the cost of the stool blood test is very cheap. You're talking about less than 100 ringgit.
Okay.
Okay. So at the very least, you should do that. Yeah.
Mm.
But of course, if you can, then obviously you should get a colonoscopy. Yeah.
Yeah, interesting. Thanks, doctor. It's nice to see. I mean, 10 years ago, probably colonoscopy may be the only early detection tool or for screening. But today, like you said, there's like a test you can just take, like a pregnancy test. And in this, this could be due to all the research that's done.
Yeah,
And
definitely.
we are coming with much better detection tools.
Yeah.
So in that same note, doctor, when it comes to cancer, a colorectal cancer, why is cancer research important, especially in the Asian settings?
Okay. I just like to share something very interesting, right? Um, we have seen an increased risk of colorectal cancer as the country gets richer.
Mm,
So, so the richer a country becomes, okay, if you look at the West,
yeah.
Australia, UK, New Zealand, even Japan and all that, their risk of colorectal cancer increases. Now, if you go to a less developed country, maybe Bangladesh, Nepal, the African countries, the risk of colorectal cancer is actually less.
Mm,
So even from there, research is needed to know why is this.
correct.
Of course, there are a lot of theories. It may be because as you get richer means more affluent, sedentary lifestyle, obesity, as
Mm,
mentioned, all the modifiable risk diseases, processed food, nice
correct.
McDonald's, KFC everywhere.
Yes.
Okay,
Yes.
I mean not to put down the brands I'm talking about, but generally processed foods. Okay.
Mm,
So, yeah, so that's the thing. So you can see that there are differences in the West and in the East. Um, there are certain diseases that are more common in the East.
yep.
And therefore, and not only that geographically, but as I mentioned, even in Malaysia, you have ethnic differences in terms of the incidence of the
Correct.
cancer,
Correct.
right? You get, as I mentioned, Chinese men have the highest risk.
Mm,
Uh, then, generally men have the a bit higher
okay.
risk. But of course, we see it a lot in women nowadays too.
Mm,
But generally, we see it a lot in the Chinese population. And we must understand why. We don't have an answer in exactly why this is happening.
yes.
Research is also needed to address barriers to care. I think it's very
Correct.
important, okay?
Correct.
Because I mean, I can tell you one thing. I used to work in the university, and we do research on why some patients who undergo radiotherapy or chemotherapy before surgery don't come back. Which means that they finish their chemo, their radio, they feel better.
Mm,
They're supposed to have the operation,
surgery,
but they
yes.
but they run away.
Mm,
And and the reason we found is that these patients are scared of a stoma, a bag, getting a bag after
okay.
surgery, right? I mean, nobody wants a bag after surgery. And that's interesting because this problem you don't see in the Western countries.
Mm,
You see it in a lot in the Eastern, I mean, in the Asian
settings, yep.
population. So there are cultural differences
Correct.
that needs to be addressed, and you don't do research, then you won't be able
Wouldn't
to.
know. Yes.
Yeah,
Yes. At least you will know where the intervention can happen so that we can help people better.
exactly. Yes.
Yes. Okay.
Yeah.
So, doctor, how has genetic testing and precision medicine changed for colorectal cancer?
Okay. I think that's very, very important question. Um, Now, and we'll talk about going to see a genetic counselor later, right?
Mm,
But
yes. Yes.
but when a person is undergoes, I mean, see a genetic counselor and does some genetic testing, um, it can help the person know his or her own risk, their family's risk, which means you may want to know what the risk factor is for your children or for your parents or for your other family members.
Correct.
Okay. Um, so that is before, I mean, if you're diagnosed or even before surgery. Now, there is a role for genetic testing when the cancer has been removed. So
Mm,
these cancers are taken to the labs and some genetic testings are done on the cancer because there are certain genetic changes that happen in some cancers and some people and some who don't happen. And the importance is that when treatment is given, I mean, you're talking about cancer treatment, lah.
Mm.
Okay, there are newer drugs out there, we call them targeted therapies,
Yes.
that helps that, I mean, if you have a certain type of cancer and it's more sensitive to a certain kind of drugs, what we call targeted therapy, then this drug can be given, and then the risk, I mean, and then the response to treatment or the outcomes can be better for that
Better.
patient.
Yeah.
Yeah, yeah. So generally, so basically two things lah. One is in the risk assessment
Mm.
of the patient, and two is in the treatment when the time comes for it lah. Mm.
Interesting, interesting. So, doctor, you touched on genetic counselors. So maybe you could explain there's genetic testing, but why is the role of a genetic counselor important?
Yeah. I think, if you go on social media nowadays, on
Yes.
Facebook, of course, depending on the algorithm and what you're surfing on the net, uh, you get bombarded with all this talk about, oh, you should do your own genetic swab test or your blood test. There are a lot of people trying to
Mm.
sell product on testing. But I think it's not as simple as that. No, it's not as simple as going to the lab, taking your blood, and then telling you, oh, you have risk factors for cancers and all that. I think most important thing is, okay, first, do you need it or not?
Mm.
Okay. Now, in colorectal cancer, at least, if you have significant family history, like what I mentioned, first degree relative, second degree relative, if you develop cancer at a young age, you're talking about less than 50 years old, okay? Because we do see that. We do see, I mean, just last week I saw somebody who's 28 years old. So if you see people who are young, less than 50, or you yourself are less than 50, yes, you should see a genetic counselor, because you want to know what is the risk. I mean, do you have any risk of developing other cancers,
Mm.
or what about the risk to your family? Now, before you take a test, you must see a genetic counselor, because the genetic counselor will assess your risk. Okay, you go through the detailed family history, find out exactly what disease are there, who has it, at what age. Okay, and then they can recommend what type of genetic testing. There are many types.
Mm.
Okay, there are many options. Some are blood, some are saliva, and obviously all this costs money. So you probably would need guidance on the best way to spend your money, rather than just take everything, and it may not be useful. And then when this test is done, you won't know what is what, because
Yep.
sometimes it's very scientific, and you need somebody to help you read the results or
Correct.
interpret the results, isn't it?
Interpreted. Yes. Yes.
Yeah. And then based on the interpretation, then they can advise lah on how often you should screen, or
Mm.
what is the next treatment you should do, what advice you should give to your family, or if the family is there, you can invite them. The genetic counselor can advise, because all this has implications.
Yes.
If you have a family history and it's a genetic thing, sometimes the insurance may not want to cover.
Yes. Yes.
So all this has well, legal, has financial implications. So it's not something as simple as just going to the lab and take a blood test.
Correct.
Okay.
Correct.
So I think that's the role of the genetic counselor, and the genetic counselor can also help you connect to resources. I mean, Google is very easy, but there are things that are probably more verifiable, more
Correct.
valid,
Correct.
isn't it? Yeah, or support groups, even if
Yes.
you need to lah. Mm.
Yes, correct. Because there are like as you mentioned, there are so many different tests out there, and you don't want to go do something and you're not clear what the results is trying to tell you. You're not able to interpret. It may be something more serious, or it may be not. So don't put yourself into unnecessary stress. Go through the correct channel, correct pathway, so that the correct people can guide you through as well. So, doctor, my next question is, what lifestyle changes can help reduce the risk of colorectal cancer?
Yeah, well, I think it goes back to the problem. I mean, to the what we talked about, modifiable, isn't it? Yeah.
Yes.
So I think we don't eat the same kind of food like our grandparents or great grandparents eat, right? I
Yes.
mean, of course, our food we buy from the supermarket. We don't know what's the process of it coming to the shelves. But having said that, I think we can't be growing vegetables on our own all the time, at least, not on a big
Not
scale,
convenient now, yes.
right? But generally, you got to watch what you eat.
Mm,
Probably cut down on processed food, red meat,
mm,
okay, and increase your fiber intake.
yep,
Vegetables, fruits, they are all proven to have antioxidant properties. And obviously exercise. You don't need to be a marathon runner, but you need to do some exercises. Suited to your age and time.
time,
Uh,
yes.
and I think that's very important because obesity and Malaysia is the fattest country in Southeast Asia.
Interesting. We are one of the smallest, in terms of geography, but then,
Yeah, we are fatter than Philippines, Thailand,
yes,
Indonesia, or whatever. Okay.
correct, correct.
So we see this cancer risk increasing.
Mm,
And if you have diabetes, this diabetes not only needs to be controlled because you want to prevent heart attacks
yeah.
and strokes and all that, but it's mainly also it increases the risk of cancer and you got to just get it controlled. Yeah.
Okay, okay. Thanks, doctor. So,
Mm.
last but not least, doctor, could you share some common myths when it comes to colorectal cancer? There's too much of information on the internet today, and people just tend to believe whatever they read. So maybe it's good to come from you and an expert in this field.
Okay. Yeah, I think that's a very common question. As I mentioned, people don't like to talk about their bowel habits, don't like to talk about their poop. And it's good that you asked me this question. I think the first thing that's a common myth, number one, is that this disease only happens in the elderly. Okay.
Mm.
Yes, that may be true before, but we see it younger and younger. The youngest I've ever seen is 14.
Ooh,
So
okay.
obviously, when you're at the age of 14, then you'd have some genetic thing going on there,
Yeah, yeah.
right? It's also a common myth that it only happen in men, and that's not true. We can see that in Malaysia, it's the second most common, second to breast. So, and that's why we recommend screening. The other myth is that it's always fatal. You
Mm,
know, I can tell you one thing though, colorectal cancer is probably one of the most forgiving cancers. Forgiving meaning even if you catch it late,
mm,
provided not too late lah. Not too late means it's spread everywhere, then it's a bit too late. But if it has spread even just to say one point in the lung or one point in the liver, and you remove that point or that problem, you can actually cure the patient.
oh, wow.
It's
Mm,
not fatal, right? All
mm,
the time, at least. That's different than certain cancers. If you have breast cancer, for example, and the cancer goes to the lung or liver, no matter what you do, it's a little bit too late
mm.
because of the biology of the tumor.
Ah,
Okay,
okay,
something
got it.
called something called micrometastasis. Okay, I don't want to go too detail on that, but in colon cancer, you don't get that. So
Mm,
a myth to say that it's always fatal.
okay. So there's
And
hope.
yeah, there is hope. So, it's very important to catch it early. I mean, you still don't want to wait till you're stage
Yes,
4 and then
that's
you
true.
want to
That's
treat
true.
it. All right. The other thing is that you only screen if you have symptoms or a family history. And I think that's very, very wrong. Okay. That's not called screening already. If you have symptoms, it's not called screening already.
Yes,
It means it's like you're actually checking for something.
correct.
So if you reach 45 or 50, no family history, no symptoms, get yourself checked.
Mm,
Either with a colonoscopy or with fecal or blood stool test. Yeah. Yeah.
okay, okay. Thank you, doctor. And that was my last question for the webinar today. I'm just going to take a short 2 minutes to introduce about Cancer Research Malaysia, the work we do, especially when it comes to genetic testing. So
Sure.
allow me to do so. Okay, this is genetics, which is wholly owned by Cancer Research Malaysia. We do provide genetic testing and genetic counseling services. So, as Dr. Luqman explained earlier as well, that genetic counselors, they help us understand genetic information much better. They help us interpret the results. This is so, so important because I've seen people going out there and doing a lot of these different tests that's out there in the market, but they're not able to understand what the report is telling them. Okay. And they also give us guidance and emotional support. Sometimes receiving this news can be scary, not only for you, but also your family members. So they're counselors. They're actually registered licensed counselors who are able to guide you through this journey. So these are some of our certified genetic counseling team, our advisor, our anything but partnership inquiry, you can reach out to them. Okay, these are our services for common hereditary cancers, breast and gynae cancers, colorectal cancer, prostate cancer, personalized cancer risk assessment as well. This will be the patient journey, patient express of interest. We do a pre-testing counseling, the genetic testing is done, and you also have the post-testing counseling support as well. Okay, and that's a wrap for me. And we are from Cancer Research Malaysia. We're an NGO based in Malaysia, and we get most of our donations, whether it's through grants and support by from the people. So if you would like to support us, you can take a scan of the QR code here. There are different ways you can support us. We have fundraising events as well. So we have the Race Against Cancer run event happening on the 25th of May. If you would like us to do, if you want us to do more impactful research on Asian cancers, and if you have heard it from Dr. Luqman himself, how important is research when not only for colorectal cancer, but all the cancers out there. We want to come up with better detection tool. We want to come up with better treatment methods so that more people can survive the disease. Okay. So it's happening on the 25th of May. Come and do support us. You can take a scan of the QR code there if you would like to attend. Last but not least, I would like to hear your feedback, how the webinar went today, what kind of topics you would like to hear from us. So do take a scan of the QR code here. I'm just leaving it on the screen for a minute. Okay, I'm going to share another document. Okay, so this is actually our promo for Colorectal Cancer Awareness Month by the genetics team. So we have the standard oncology panel and expanded oncology panel. And this promo is running only for the month of March for Colorectal Cancer Awareness Month. So if you would like more information, please take a scan. You can actually contact this number here, and they'll be able to help you, or you can also email them. Okay. Right. And I will be moving on to the Q&A now. So the first question, morning, are you providing us a certificate? Yes, there would be an attendance certificate. You will need to wait for about 30 days to get your attendance, about 2 weeks to 30 days to get your attendance certificate after this webinar. The next question is, Doctor, I think all the colorectal issue is due to high sugar consumed by a person. So doctor has said that, I mean, of course, your lifestyle and your diet plays a very important role. So it can be sugar, it can be so many things as well. Doctor, would you like? Yes, definitely.
Yeah, can I add to that? I think there is some truth to that.
Okay.
That obviously, if you are uncontrolled diabetic, you have a risk of that. Now, having said that, that can also be a double-edged sword because if you believe in that, then we find that there is a very common myth that when a patient undergoes chemotherapy, okay, or undergoes cancer treatment, they don't want to eat, drink milk or proteins or anything sweet because they say that the sugar from the drink will only feed the tumor that you already have, I'm talking about. And that's not true. Okay.
Okay.
Sometimes good sugars, good proteins, good nutrition is required to help you overcome the malnutrition related with the cancer,
Yes.
right? And while you should control your sugar levels all the time, that does not mean that you go on a strict diet,
Mm,
and especially when you have cancer, based
yes.
on this belief. And I think that's something important.
Yes, thank you, doctor. I've heard about this thing about, if you eat sugar, it's feeding the cancer cells, so you shouldn't be doing this. So it's like I said, it's always very important to speak to the expert because they have done their research, they have seen people, they will be the best person. Don't simply, read whatever that's on the internet. Okay, second question. I think, doctor, you will know this question better. I don't quite understand it. It says, can fecal M2 PK test as a primary screening test for colorectal cancer? Is it more reliable than FOBT?
Yes. Okay. So I think that's a good question. I didn't want to go into detail on that so much, but yes, FOBT is a fecal or cord blood test, right? Like what I mentioned. Now, there are many types of fecal or cord blood tests. Um, and the ones that we use is what we call the immunohistochemistry test, okay? That means that the difference between that and the old blood test is that it differentiates between human blood and food blood, blood in the food. I mean, if you eat a nice rare steak and you get blood, and in the previous old test, that would be positive. But nowadays, that will not happen because it's not human blood,
Mm,
right? But then nowadays, you have something called uh, stool blood test based on tumor DNA. Okay. Um, and like this M2 PK. So yes, it's more sensitive. Um, it if it's positive, it tells you that there is a risk of that you have polyps
mm,
or you have tumor, but it cannot 100% tell you it's a tumor. It's more accurate than the stool blood test. However, it's also very much more expensive.
mm,
So a fecal occult blood test may cost less than 50 ringgit. Whereas M2 PK test may cost about close to, well, depending, 800 to 1,000 ringgit. So on a population-based screening, you can't recommend it. But of course, at the individual level, you can, right? And I see a question on something called ctDNA,
mm,
which is called circulating DNA. Now, that is a blood test, okay? It's still very much in the research phase. Yes, a lot of people are talking about it. It needs more evidence to prove whether it can be used as a very reliable screening method,
mm,
but it shows promising results. And I think we'll get some good recommendations on the use of that. But it also costs money.
mm.
CTDs are not cheap. I
Yeah.
mean, you can afford it, it's okay. But let's wait for the guidelines. Let's wait for more evidence to recommend it to the general population for that. Yeah.
Okay, thank you, doctor. The next question is, okay, so before I read out this question, we do not give any specific medical advice online. So I suggest if you need some advice, the doctor will need to look at your medical history before it is given online. Yeah. So the next question is, I was diagnosed at 47, stage 4 in 2023, rectal cancer with a permanent colostomy and have done a genetic screening by Caris. I'm currently on Avastin. Would there be further options when current med wears off? Thank you.
Yeah. So basically, I mean, thanks for sharing that. So basically, she has stage 4 colorectal cancer, and
Okay.
she's on some medications, chemotherapy, to try to kind of suppress the disease. Um, Now, I think that is where the importance of your next generation sequencing NGS panel. Basically, I talked about it earlier.
Mm,
They do testing on the um, on the tumor that has been removed.
okay.
Yeah, I see.
Got
Okay,
it.
you had surgery, so the tumor is removed, right? So when you do that test, then you know what genetic or what DNA mutations or differences you may have. So the oncologist will then give you targeted therapy if there's a recurrence, or if the tumor markers are increased, or if there is this tumor flares up again, then that's where the role of this tests, these panels are done so that they can give targeted therapy to you. And I hope that answers your questions. Because if it's not done that, then I mean nowadays a modern oncologist would already have checked it, so that they know what other bullets or weapons they can give to fight this disease for you. Yeah.
Okay, thank you, Doctor. Next question. Thank you for your informative talk, sir. Appreciate pointers shared. My question, what exactly is processed food? Because in my mind, even cooking can constitute processing. And for most of the time, the Malaysian diet, we can't escape the processed food. So how then does one unprocessed food short of eating raw?
Yeah. I think processed food generally means food preserved in tin
Mm,
cans,
yeah.
food that is mass produced, say burgers, sausages. You don't really know what exactly you are eating. Having said that, if you go to the mama and eat nasi kandar and you order vegetables and that's not really processed food lah.
Yeah.
If it's fried chicken is fried, okay, fine, but it's a chicken. It's not some piece of chicken nuggets, which that
Yeah.
one is probably processed. So I think
Correct.
there's a
Correct.
difference there. So you probably
Yes.
should eat natural foods rather than
Yes. Yes.
rather than foods that are already don't look like food anymore.
Correct.
Yeah, get it?
Correct, correct, correct. So doctor's not advising you just go and eat raw food, You can still enjoy your food, but just
Yeah.
know your boundaries and have a balance. Okay. This will be the last question, doctor. What do you think about supplements to help for colon health?
Okay. I think generally supplements in general is good, especially if you get older. However, uh, I don't think there's any particular supplement that you can use
Hmm.
to to um, to prevent colorectal cancer. Screening is very important still. You may consider, say, probiotics, because the colon has good bacteria and bad bacteria. And if
Yeah.
let's say, if you take antibiotics to fight an infection, a lot of the good bacteria get killed, and you may want to repopulate that with good bacteria. So you take probiotics, because there are a lot of research done at the moment looking at the relationship between the bacteria in your colon with relation to your risk factors of developing
Hmm.
cancer. And that's a lot of research going on. So I think there is some association. Can't really can't
Yeah.
can't really pinpoint exactly what yet, but definitely but that leads me to the next thing, which is a very common question. Should I do colonic cleansing? And because there's a
No.
lot of there's a lot of people out there, or rather, businesses out there who may promote that. And scientifically, it is not proven.
Hmm.
Okay. I mean, colon cleansing is a process where you go to this, to this place. They put in something into your colon and just wash out everything,
Hmm.
in the belief that you wash out all the bad stuff too. And and
Okay.
and that is not our current understanding of the disease. In fact, it can be very dangerous because
Hmm.
you're putting lots of amount of water, and if the water is too fast or too much, it can cause injuries, and we
Hmm.
have seen that. So as a medical doctor, I can't give a recommendation for that. Yeah,
Okay.
yeah,
Okay, okay. So
yeah.
thank you, Doctor. Very, very insightful sharing. Just like me, I'm sure everyone here has understood a bit more, I think a lot more on colorectal cancer. So thank you, Dr. Luqman. Thank you, Hospital Picaso. And thank you everyone who attended the session today. I hope all of you had great insights. And wishing you all the best. Selamat Hari Raya, Doctor. I think next week is
Thank
Raya is
you.
coming
Thank you
up
very
soon.
much. And
Have a
thank
good
you
time.
all of you for attending, and spending the late morning with us. If you have any questions, you can email Vishala or myself, get in touch. You can find me on the internet, Google my name, and I think you can get my email there. You can direct your
Okay.
questions to me. All right. So
Thank you.
thank you very much. You
Thank
have a
you.
good
Thank
day.
you. You
Yeah.
too. Thank you. Take care.
Bye-bye.
Bye bye, everyone.
Bye-bye.